Good evening, everyone. You are with me, Samuel, on this Facebook Live session from CBCC India. And we have with us Dr. K.N. Srinivasan from Trichy. So, welcome.
Thank you.
Just
It's a
a brief
pleasure and
introduction.
honor to be on Facebook Live, and especially on a very close to my heart. And many of our women, the backbone of our society, the brain of our society. So we're going to talk about them. I'm happy about that. Let's move on.
Yes, sir. Yes, sir. We are very glad that you have taken out the time and you're speaking to our viewers. Thank you so much, sir. So before we begin with the Facebook Live session, a brief introduction about Dr. K.N. Srinivasan. Dr. K.N. Srinivasan is a consultant radiation oncologist and nuclear medicine physician at Dr. G. Viswanathan CBCC Cancer Center, Trichy, Tamil Nadu. He graduated from Sri Ramchandra Medical College in 1991. He later obtained a postgraduate diploma in radiation therapy and postgraduate diploma in radiation medicine. He is also a part of many prestigious oncologist groups and associations. Doctor, we are really glad that we have such a resourceful person in you speaking to us today.
Thank you. It's
Uh,
my pleasure.
so, so, without wasting any time, we move on directly to the questions. The topic for today is thyroid cancer and cancers in women. So, doctor, please let us know what is thyroid cancer.
Yeah. Generally, cancer is an abnormal growth of uh, tissues or cells in the body. Unfortunately, it is a less understood uh, term. People immediately, the families, the person, the society gets affected by this term cancer itself. Now, cancer is like any other disease, and especially cancer of the thyroid. Thyroid is a gland uh, which secretes hormones in our body. It's called the master gland. It is present in the neck, and it is very useful for the development of the child, for the growth and nourishment of the child, and in adults. All organs are controlled by thyroid gland. It is right here in the neck, and that gland, like any other organ in the body, can turn cancerous. So, malignancy or cancer of the thyroid is quite common, and we do see a lot of young women and very rarely male men with affected with thyroid cancer. So yes, thyroid cancer is a cancer affecting the thyroid gland in the neck, the anterior neck of the body. So if that answers your question.
Yes, doctor. The next question that I have is what are the most common types of thyroid cancer? Do we have any types of thyroid cancers?
Yeah. So first of all, I should reassure all my viewers here is that thyroid cancer is one of the curable cancers amongst all the cancers. While we are taught, we are always taught that if at all, if God comes across and tells you, look, you have a boon or a bane, I'll tell you the bane first that you are going to have cancer, and the boon is that you can choose what kind of cancer you want. So we are always taught, please ask for the boon that you'll have a thyroid cancer because thyroid cancers are curable cancers. Now, having said that, thyroid cancers are generally divided into a couple of types. The differentiated types, which perform very, very well, and they are the commonest types. The differentiated thyroid cancers are the papillary carcinoma of the thyroid and the follicular carcinoma of the thyroid, with a few variants here and there. There's also a medullary carcinoma of the thyroid, which originates from the parafollicular cells, and it's also one of the curable cancers. One of the very, very rare types of thyroid cancers, I should say less than zero point 0.1 or 0.01% of thyroid cancers, is what's called the anaplastic carcinoma of the thyroid, which is not curable, but definitely with today's technology, we can still control those people and try to alleviate their difficulties and pain. but 99.99 types of thyroid cancers are curable cancers.
Thank you, doctor. So, what are the symptoms of thyroid cancer? When can we know that we might have thyroid cancer?
Yeah, thyroid cancers are one of the silent cancers. It's not like you have swellings across the body and swellings in the neck and all that stuff. But we got to keep aware, especially not only my patients or the public, even doctors should be aware that any swelling in the neck should be taken into concern, should be looked at carefully, especially in young women. It should be looked at more carefully. And any long-standing, I say, goiters in the thyroid gland, there is already existing swellings, they suddenly increase in size or causing pain or anything, should be looked at carefully. Again, not all swellings are cancers, but there's a possibility of cancers, and that should be looked into. Apart from that, very rarely it can be detected in a different way. Like, for example, a lady suffers a fracture, a bone fracture, and that when they analyze and they study the causes for the fracture, that could be a very, very brittle bone, and that bones could have been affected by thyroid cancer. So that's the retrograde way of analyzing and trying to uh, find out cancer, thyroid cancer. But almost all the time it is quite silent, and there are sudden swellings in the neck which we need to look at carefully, and the doctors should appropriately investigate them and try to rule out thyroid cancers. That's it.
So, doctor, are there any risk factors or causes of thyroid cancer? Can we avoid it, or
Yeah,
what are they?
that's nice. But the probable causes of thyroid cancers which were looked at, or the high risk group which we say is basically it's young women. And uh, other one we should look at is it was always told that exposure to high radiation is another cause. But today, honestly, how many of us are exposed to high levels of radiation? Probably never. Even people living near and around uh, nuclear reactors do not are very safe. The reactors today are very, very safe. The old type reactors did have problems, or the so-called atomic bombings which took place during the world wars, the Hiroshima, Nagasaki kind of bombings. They can stimulate thyroid cancers. But apart from that, these are all anecdotal things which we need to remember. But apart from that, there are no big risk factors uh, for thyroid cancer as such. No habits, no dietary pattern or anything which we should be worrying about. Just that we be aware of any swellings in the neck and meet our doctor regularly. That's it.
So, doctor, how can thyroid cancer be diagnosed and then treated?
Yeah, that is right. Because as I told you, it's one of the most treatable and most curable cancers. So, how do we approach a thyroid cancer patient? I wouldn't say thyroid cancer patient, a patient who comes with you for the swelling in the neck and is worried about cancer. First and foremost, reassure them that all swellings in the neck, all nodules in the neck need not be cancer. Second thing is, there are certain imaging techniques. The imaging techniques, I would say, the most important, the most commonest one is which is used and very, very useful is the ultrasound of the neck. Ultrasound of the neck is like ultrasound of the abdomen which you do, or ultrasound, to look at the liver or kidneys or any other organ. It's the same kind of ultrasound which is done on the neck, and especially you look at the vascularity to the nodules, and based on such some criteria in the ultrasound, you say that it's a probability of cancer in these nodules. Now, the other thing is to look for the lymph nodes in the neck. In no, Tamil, from place where I come from, we always say nerikattigal. Is there any lymph nodes? Gant hai kya? So, wo to dekhna padega. We have to look at those kind of lymph nodes in the neck. So, ultrasound looks at all of them, and then you pick up appropriately the nodule and do a guided biopsy or an FNAC to prove that it is cancer or not. So that is the way, which is a commonest approach. Some of the nodules can be indeterminate. We do not know whether there is cancer or not. What kind of nodule is that? There, nuclear imaging comes into play. When you say nuclear imaging, we inject radioactivity in the arm, in a vein, intravenously, radioactivity called technetium-99 pertechnetate. Now, a technetium thyroid scan is a very easy way to diagnose, because once it is injected, you image the thyroid gland after 20 minutes. You differentiate between cold nodules and a hot nodule. Now, cold nodules means there is no activity or no functioning thyroid gland in that particular nodule. Now, non-functioning thyroid nodules have to be considered as malignancy, because 20% of such cold nodules, non-functioning nodules, have a possibility of cancer. So we have to look at that very closely, and technetium thyroid scans are the diagnostic way of doing that. It's a very simple test, not much of a worry, not much of a cost, not much of a radiation exposure or anything to be worried about, and it's very routinely done in almost all the major cities.
So, doctor, how does thyroid cancer affect the body physically? And I would also like to add the everyday lives. How does it affect?
Yeah. Now, thyroid disorders per se, hypofunctioning thyroid gland, which we call hypothyroidism, or hyperfunctioning thyroid gland, is called hyperthyroidism or Graves' disease. They affect the day-to-day lives of a woman. Like hypothyroidism, the lady can become very tired, very exhausted easily, become obese, skin gets dry, there's a lot of hair fall, there are menstruation issues, and so on and so forth, and sleep disorders and all those things. So they affect your day-to-day life. Whereas a person with thyroid cancer doesn't have hormonal imbalances, so it doesn't affect the day-to-day life of a person. And after treatment, at the completion of treatment for thyroid cancer, the person is put back on thyroid hormone. I wouldn't say supplementation, rather, I would say it's a TH suppressive dose, but thyroid hormones are given to them orally so that their day to day activities are taken care of and nothing to worry. One thing which we always advise the person who has undergone, who's having a thyroid cancer, it doesn't affect their day-to-day life unless otherwise a variant called the follicular cancer, which can present with a bone metastasis. There, there is a spread to the bone, and if you are diagnosed through a fracture in the bones, then the quality of life gets affected because of the fracture, not because of the disease per se. Now, apart from that, after the treatment is over, the person anyway doesn't have a thyroid gland, so needs thyroid as an oral supplementation, and also calcium supplementations throughout the life. All this is throughout the life. There is no break saying, no, can I be off medicines? These are not medicines. These are like day-to-day food that you need to take them regularly throughout your life for your well-being. Otherwise, you'll be without a thyroid hormone in your body, which can affect all the organs. You'll be without a calcium or calcium disorders, and so that can affect your day-to-day life. So you need to take these two medicines, or these two drugs, or these two life-saving uh, medicines lifelong. So apart from that, it doesn't affect your day-to-day life at all. It's a very simple disease. I would request my people to just don't remove the word cancer from thyroid cancer. It's a thyroid disease, completely treatable, completely curable. Remove the word cancer, and you'll be free of your mind. The moment you put cancer into that, automatically all the fears, all the myths, that'll happen. This will happen. All those things happen. So just remove that word cancer from the mind, everything is fine. I put it as a thyroid disorder, a thyroid disease, rather than thyroid cancer.
That was really encouraging, doctor, and I'm sure that all women, all who are diagnosed with thyroid disease and not cancer, are assured that they are going to be treated well and they're going to be healed. So, after that brings me to the next question. After treatment, what are the side effects, or are there any side effects after the treatment of
Yeah.
thyroid cancer?
So, like I told you, the treatment of thyroid cancer is basically twofold. One is surgery. You know, surgery. When I mean surgery, very rarely you remove only the affected lobe. There are two lobes of thyroid gland, right and left. There are two lobes. Very rarely you remove only one lobe, which is called hemithyroidectomy, and you can still get away with it. That will be a curative surgery as such. But 95% of the time, you will have to remove the thyroid totally. You'll have to remove the gland totally, both the lobes. You know, it's a beautiful butterfly shaped organ in the neck. You'll have to remove that totally. And that means it's called total thyroidectomy. Plus or minus the lymph nodes which are affected, they also may be removed. So that is the surgery. Now, once that kind of surgery is done, we'll have to keep in mind about two things which can happen because of a surgery like that. First, the scar in the neck. Today, surgeons are beautiful. They do a wonderful job. The scar is hardly seen. The latest techniques people try to do, transaxial surgeries, or what they say, minimal invasive surgeries, laparoscopic surgeries, and all so on and so forth. But it's a very simple surgery in the neck. It's a very nothing too complicated about it. Uh, it can leave a very minimal scar in the neck, and I always tell my women, please tell your husbands, or I tell the husbands directly, buy them a beautiful necklace, and that covers the scar completely. So you are cured of the disease, and you also gain with the necklace. So that is one thing. Now, so the pain factor is like any surgery. For the next couple of days, there will be some pain, but after that, it's fine. But one rare complication, very rare complication, is your voice getting affected, because the vocal cords, which are we call the voice box, can be affected because the nerve supply runs very close to the thyroid gland, and if it gets touched, need not be cut, it's touched itself, you can have a palsy of the vocal cord, and your voice can change. So that is what we need to worry about. And before surgery, always the voice boxes are checked, and after surgery also it is checked. So today, that complication is hardly ever seen at all. The next complication, as I told you, is because of removal of thyroid gland, you need thyroid hormones, which has to be taken lifelong, and also calcium, because the parathyroid glands are embedded in the thyroid gland. They are not two separate ones, they are embedded inside. So once you remove the thyroid gland, the parathyroid also is removed. Parathyroid controls the bone, the calcium metabolism. So you can land up with hypocalcemia, that means loss of calcium in your body, and problems because of that, like weak bones and so many tetany-like symptoms and all this stuff. So for that, you need to take lifelong calcium supplementation. Apart from that, there's hardly any side effects of the treatment of surgery. Now, the next treatment, part of treatment after surgery, is iodine 131 treatment. I mean, we call it radioactive iodine therapy. Now, technically, it's called iodine ablation therapy, or we also call it as iodine 131 therapy. Now, once we say that when you give radiation, radioactive iodine, oh, there's so many problems. You're giving radiation and all stuff. No, nothing. Absolutely nothing. It is like our salt, our common salt. Every day we take salt. The salt is an iodized salt, and that contains 127, iodine 127. Now, that salt is kept in capsules, or in some places liquid form, and kept in the nuclear reactor and converted to I-131, iodine 131. Now, iodine 131 comes back to iodine 127, the stable form, by releasing radiation, beta radiation. And that radiation travels for 3 millimeters, 3 millimeters. It's an average travel it travels, and that means it will not get out of the thyroid gland itself, thyroid cell itself, and that way it destroys whatever remaining possible thyroid tissues there in the neck, not necessarily cancer, thyroid tissue in the neck. It will destroy all of them. That's why it's called iodine 131 ablation therapy. And once it gets destroyed, uh, that is what is the treatment for thyroid cancers. Now, does this radioactive iodine, do they have side effects? Nothing. Obviously, this dose of iodine or radiation does not cause any other cancer. So now, when he started saying radiation can cause thyroid cancer, you're going radiation for this. Can that cause cancer? No. This dose of radioactive iodine will not cause cancer. And there is huge amount of literature in the world. Huge amount of literature. I can tell you there are millions of people who have undergone therapy with radioactive iodine. The chance of cancer because of that is next to zero. So it is absolutely not there. So just don't worry about that. But there can be small difficulties like dryness in the mouth, or salivary glands getting swollen up, some amount of nausea and all that stuff. But absolutely, all these are short term, for a couple of days. And radiation can, through sweat, through your tears, all that keep coming out. So we always advise them to stay isolated for a couple of days before mingling with the public. So that is the basic thing. And never get pregnant for at least 1 year or so. So that is the only precaution we always advise. No side effects as such. I don't think we should get worried about the treatment of thyroid cancer or the side effects.
Thank you so much, doctor. That was beautifully explained by you. Now we come to the second part of the Facebook Live. Cancers in women. What we discussed right now, dear viewers, was thyroid cancer, and the second part is cancers in women in general. So, doctor, the first question from this second part is: what is the most common cancer for females? The most common cancer.
Yeah, I think this is also very equally important discussion because, as I told you, women are the brain and backbone of our society. We are nobody, we are nowhere without women. And women are affected by cancer. We should be very true to that, alive to that. The commonest cancers in women, the two commonest cancers in women, or I would say three. Or the first one is breast cancer. Second one is cancer of the uterine cervix. And third one is a oral and oropharyngeal cancers, like in men. Now, if you had asked me this question 10 years back, the number one cancer in women was cervix cancer of the uterine cervix. Number two, a distant two, was breast. And then was the head and neck cancers. Now, what has happened? What has changed over this 10, 15 years? Let me give you a very simple understanding of this problem. When I started my practice in 2000, 1st of January 2000, cancer of the uterine cervix in women was so high. It should be, even in our tier 2 city like Trichy, we were seeing 40 to 45% of our total number of cancers were women cancers and cervix cancers. I divided every 5 years. And at that time, breast cancer was 2 to 3%. Okay. And the kind of women which come for breast cancer was 50s, 60s. The kind of women coming with cervix cancers was also 50s, 60s. And most of the cervix cancers were coming in an advanced stage. Most of the breast cancers coming in advanced stage. Now, coming to 2005, cervix cancers came down slightly to around 30%, 35%. Breast cancer started rising to 8%. In 2010, it became, cervix cancers came down to 25 and breast cancers to 15%, doubled. That's when we woke up and the pattern changed. Cervix cancers He started diagnosing much earlier. They were all curable. They were all curable because first stage, second stage of cervix cancers, they were all curable with the treatment available, like surgery or radiation. It was all curable. Breast cancers, unfortunately, they all still came in late stages, and age group came down to 40s and so on. So it has changed. The scenario today is breast cancer is number one cancer, and cervix cancer is number two. So we see around 25 to 30% of our patients are breast cancer patients, around 20% are cervix cancer patients, and head and neck cancers around 10 because of tobacco related head and neck cancers, chewing and other things, around 20, around 10 to 15% of tobacco related cancers in women. So these are the three commonest cancers which we see in women.
So, doctor, there's a belief that more women are affected by cancer than men. Is it true?
Yeah, it is roughly 50-50. Men still are higher up because of tobacco related cancers. The commonest one in men are the tobacco related cancers. A huge chunk of them, it can be smoking tobacco like cigarettes, BDs, cigars, or whatever, or smokeless tobaccos where they use pan, gutka, kaini, and what nonsense. Everything, they chew every damn thing. And so men are still, tobacco related cancer are higher, but women are catching up. Even women, you'll be surprised. The smoking rates in women have gone up, and it's not good. And but education is the only way. You have to sustain education is the only way to bring down. Ban works to an extent, but it is only education that can bring down the tobacco-related cancers, and to an end, cervix cancers have been brought down because of education. And also breast cancers can also be brought down significantly. Yes, I believe in that.
So, doctor, one of the most common signs of breast cancer are lumps. What happens is we also have other types of lumps. So, what are I mean, how can we differentiate between the cancerous lump and the non-cancerous lump?
Thank you, Samuel. It's nice because first and foremost, I tell all my patients or public, all lumps in the breast are not cancers. Please, I repeat that. All lumps in the breast are not cancerous. If you take 10 lumps, one of them may be cancerous. One of them may be cancerous. I would again repeat to my for the benefit of people in Tamil Nadu, எல்லா மார்பக கட்டிகளும் கேன்சர் இல்லை, புற்றுநோய் இல்லை. 1 out of 10 can be, maybe cancerous. So you will have to be awake to that, alive to that, and check and make sure that the lump is not cancerous. That is most important. It's like ruling out rather than saying that, no, I have a lump, so I have a cancer. No, it is not so. All lumps are not cancerous. So what differentiates it? That's a good question again. So how do you differentiate it? Simple. Go to the doctor. Never take a chance with a lump. Because if you detect a lump at a very, very early stage, it is curable. Even if it's cancerous, it is curable. If you early detection offers the best chance for cure in breast cancer. Early detection offers the best chance for cure. ஆரம்பத்தில் கண்டறியும் புற்றுநோய் முற்றிலும் குணப்படுத்தலாம். So that chance you should be giving yourself. Go to the doctor immediately. So don't take a chance with a lump. Now, other things is we advise our women, especially about 30-35, to do a self-examination every month. We call it breast self-examination. And as a part of our drive in Dr. Shanta Breast Cancer Foundation, which we run in Trichy, we circulate pamphlets and cards and videos on how to do self-examination. And if you have done a self-examination, you punch yourself and keep a track every month. And if you find something suspicious, go to the doctor, who would then do what's called a clinical breast examination, and then if need be a mammogram. So that is what it is. And for the benefit of our rural women, we do run what is called a mobile mammography unit called a SBCF Mammobus. It was by the Rotary International, the Rotary Club of Srirangam, that we got a mobile mammography unit in 2012, 2000, and it's still running around. And it educates women on how to do self-examination. It also does mammograms in the bus itself at the doorstep of our rural women so that you can detect those cancers very early. So, how do you differentiate lumps? Don't try to differentiate. Go to the doctor. The doctor will differentiate and tell you. So, you don't be smart on that. Any lump you detect, please go to the doctor.
Thank you so much, doctor. Doctor, what are the precautions that we can take to avoid uterus cancer? Or how can we find out? How do we know what are the symptoms of uterus cancer?
Yeah. Before going to the uterus cancer, the precautions you should take to avoid breast cancer itself, I'll let you know. Because today's girls, or even all of us, are bombarded by fast foods. One of the most important uh, possible reasons which I believe in, a lot of research is going on in that, uh, is to make people aware that estrogen is one hormone that keeps stimulating the breast for its growth and turning it cancerous also. So the estrogen is produced from cholesterol, and most of our women, or most of us, are exposed to such high cholesterol levels, or high kind of, I wouldn't put it as cholesterol, I would say fatty foods as such, generally, by very early in our life, through what is called the fast food culture, which has crept into our society. And the fast food culture has taken over so much that our young girls are kind of literally addicted to fast food culture. And also the quality of our milk, we don't know. It's still a lot of questionable things in that. That also has to be studied. And most importantly, what we have forgotten are, or I would say, should I say that? I don't know. Westernization of our culture. Uh, breastfeeding has become a taboo. How many of women breastfeed? Very unfortunate. We have to now start teaching our women to breastfeed. Please feed your children, newborn. At least for 6 months to a maximum of 2 years, at least keep breastfeeding your child. That can protect you from breast cancer. So please, I request through you, all our women, please breastfeed your child. At least for 6 months to 1 year. That gives a lot of protection to your breast. Please do that. Avoid fatty foods, avoid fried foods, especially in your younger age group. If you can avoid that, it will be very, very good on that. So these are the ways, precautions you should be really taking as for the breast cancer side. Coming to the cancer of the uterus, and I would say uterine cervix mainly, uh, it is because of unhealthy sexual habits. Basically, uh, we have moved from that era, but still, it's quite common that unhealthy sexual practices is one thing which we should be worried about. Multiple sexual partners, the the human papilloma virus, the HPV virus, which can be transmitted sexually, affects the uterine cervix and converts it to cancer. Now, that is other thing. And the other one is having multiple children. Having multiple children without a gap, year after year after year, that can also, affect your uterine cervix and convert it to cancer. So these are the two important things, and not maintaining a good hygiene, a genital hygiene. So these are things which you should be really worried about and take precautions on that. Say no to multiple sexual partners. One man, one wife probably is the best norm, or practice safe sexual practices and have just one or two children, and breastfeed them, you can prevent so many cancers from happening.
Thank you, doctor. Uh, what are the most common causes and risk factors of female cancers in all?
Yeah, as I told you, basically, this, I know it will be a repetition. These are important things that every woman or every man also should know. Is the mother, your sister, your wife, they are very important part of your life. So make sure that they eat healthy, eat smart, and do adequate exercises, and are not exposed to high tobacco life, or a tobacco, be a tobacco free person. So if you eat healthy with good fruits, basically there's a good saying: an apple a day keeps doctor away. I would also add, a carrot a day keeps cancer away. So that is a very important thing that you should understand. So eat smart. Second thing is, avoid multiple sexual partners. Other risk factors, breastfeeding. I told you that you will have to breastfeed regularly. If you don't breastfeed, you're exposing your breast to cancer. So understand these things. These are the common things of any female cancer. Are these three things: breastfeeding, avoiding your breastfeeding, obesity, and multiple sexual partners, poor sexual hygiene, poor genital hygiene, and tobacco. These are the main risk factors for any female cancer as such.
Thank you so much, doctor. By now we've covered almost entirely female cancers and thyroid cancer both. So we come to the second part of this Facebook Live. Uh, but I'm sure that our viewers who are viewing this Facebook Live might have some questions. So we might have to take some questions, doctor, and you can respond to those questions.
It's a pleasure.
So, Miss Hiral Shah, she asks, how urgent is thyroid cancer surgery?
Oh, okay. Ms. Shah, I would tell you one thing is, do not panic. There's nothing called urgency or an emergency in a thyroid surgery. But the moment you know that you have a thyroid problem, a thyroid cancer which needs surgery, do it as soon as possible. So that is the right way of approach, rather than panicking over it and saying, no, it's an emergency, I should do it. It's not an emergency surgery. Please plan it and get it done as early as possible. So go to your doctor, discuss with them, fix up a good date, get all the tests done, and go ahead and do your surgery. I reassure you, it's not an emergency surgery, but get it done as soon as possible. Thank you, Shah.
Thank you, doctor. Uh, Miss Pragya Khanna asks, doctor, is thyroid cancer completely curable? So we've already answered this, but for the benefit of
True,
Miss
but
Pragya.
thank you, Prajna Khanna. Uh, I can reassure you again, thyroid cancers are, by and large, 99.9% of them are completely curable cancers. Exceptions don't make the rule, but there are a few exceptions like anaplastic carcinoma of the thyroid. They're very, 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 very rare. So don't even worry about that. But apart from that, almost 99.9% of thyroid cancers are curable. Yes, curable.
Thank you, doctor. Uh, Miss Janvi Singh asks, how do I manage the side effects of thyroid cancer treatment?
Yeah, Janvi Singh, thank you. Like if you have to undergo surgery, you'll have to undergo surgery for thyroid cancer. I told you a simple way after you get out of the thyroid cancer surgery is to request your, or demand from your husband, or demand from anybody, get a necklace for your neck and close your scar. That's a very simple thing. But apart from jokes apart, I would really tell you the side effects are negligible, nothing to worry. Even after iodine 131 therapy, some amount of dryness in the mouth and some amount of nausea, all this can be easily managed. I always tell them, use some ginger, homemade, home available ones like ginger can be used as a silagogue to stimulate your salivation. That's a very good silagogue. and keep gargling regularly. Salt water, simple salt water gargle, or even warm water gargle. That should take care. But hydration is the key. Keep yourself hydrated for a correct couple of days, a few days, till your doctor says you can double flush your toilets and try to be a bit isolated for a couple of days after iodine therapy, and do not get pregnant for the next 1 year or so till your doctor says. So apart from that, all these side effects are negligible, can be easily managed. Thank you, Dr. Janvi.
Thank you, doctor. Uh, Vipin Gorana asks, will treatment affect daily activities? Can still work full time?
Yeah, Vipin Gurana, this management of thyroid cancer is outpatient technique or outpatient treatment, and even surgery is become a daycare surgery. People get admitted overnight, next day morning have surgery, and by then late night, late evening go back home, and they can go back to their work. And after iodine therapy, you can go back to work, resume normal activities in a couple of days itself. So it is there's absolutely no major, leave or holidays to be taken for the treatment as such. All of them are on a daycare basis, and you don't have to skip your day-to-day activities at all. You can be up and about every day. There's no, I wouldn't say hours or days. Every day you can continue to do your work. I hope that answers the question. Vipin. Yeah.
Yes, doctor. Thank you so much. We have the next question from Miss Shumona. How would I know if I have cancer? How to detect cancer?
That is nice, Sumana. Thank you, Sumana. Uh, Generally, we always say there are seven signs or early symptoms of cancer. You should be aware of these seven of them. First and foremost is any lumps or any nodules which come up suddenly in your body. So please go to the doctor. Any change in voice, uh, please, especially when you have tobacco-related habits, please go to the doctor. Any difficulty in swallowing, please go to the doctor. That could be oral or esophageal cancer. Any bleeding from an orifice, unusual bleeding from an orifice, apart from menstrual bleeding during the menstruation. Apart from that, any other bleeding from any other part in the body should be taken very seriously, and you have to meet a doctor. That could be cancer. So that is other thing. From your nose, from your mouth, if you cough out blood, or if you vomit out blood, or if you pass motion in your stools, blood in your motion, blood in your urine, um, all these things, blood discharge from your nipples, you should definitely go and meet your doctors. So that is about the third, fourth one. Now, sudden loss of unexplained loss of weight is other thing which you should look at. It's a very vague symptom, but still go to the doctor. It can be because of diabetes, because that is the number one disease in India today. It can be a thyroid problem. It can be anything. It can also be cancer. So please look at that. Now, the other one is a cough, a nagging cough for more than 2 weeks. Please go to the doctor. In India, the commonest cause is tuberculosis. Never forget that. But still, there is a possibility of 10% being cancer. So please go to the doctor. In Western world, the one more thing which is added is a wart in the body, a mole in the body, which increases in size or bleeds. Please go to the doctor. That can be a mole cancer, a skin cancer. So apart from, these are the things which you should also be always be really looking for, and advise our relatives, or advise our friends, or advise our family members, whoever it is, about these seven cardinal signs and symptoms, so that you're aware of that and go to the doctor and take care. And I again reiterate, all of these symptoms are not necessarily cancers. There are a lot of conditions which can cause the same things. But if it turns out to be cancer, and if you diagnose early, that is the best chance for cure. That is why we keep on reiterating this. Thank you, Sumana. It's very nice. Thank you.
Thanks, doctor. I think we have come to the end of this Facebook Live, Doctor. I must, on behalf of all our viewers, I must let you know that you have been really, really kind, and very simply you've explained such a serious topic, such an important issue such as cancer. And I love the part where you said uh, thyroid cancer is not cancer as cancer at all. So that makes a difference in the mindset of the people, and you know people will now be comfortable at least to go and show the doctor, speak to the doctor, and find out if it is cancer or not. And then your reiteration that cancers are curable, doctor.
I would
It is
reiterate, I would just want to add one small thing.
yes.
Today there's a lot of misbeliefs and myths around cancer, especially the word cancer itself. I want to reassure my people. It is like any other disease. You have learned to live with diabetes. Okay, India is the capital of diabetes in the world, and you are living around with such a disease, which is no cure. You live with medicines. You take insulin. You change your lifestyle. You eat, diabetic laddus. You take diabetic ice creams. So on and so forth. You just change. Your lifestyle gets modified, and all those things. Cancer is also a curable disease. Never forget that. If you diagnose early, 90% of cancers are curable. There are a few cancers which work is still going on. There are a few cancers which cannot be curable but can be controllable. You will live very well, live your quality of life, live your life to the fullest. There will be some small difficulties, but you can live along well. Very few cancers literally kill you. So don't worry about that cancer which will kill you. Take home the message that if you diagnose early, there is the best chance for cure any cancer, especially breast cancers, cervix cancers in women, and more importantly, thyroid cancers are curable at all stages.
Thank you so much, doctor. That's really encouraging. And I would like to inform all our viewers and invite them to think upon this. Uh, like Dr. K. and Srinivasan, we have a wonderful team of doctors at CBCC, and who are there to listen to you, talk to you when you go and speak. Even if you are in doubt, cancer is such a disease that is curable, but only if detected early. Chances of cure are better. So go and speak to the doctor, the team of doctors, and they'll analyze. They'll help you know what the situation is and what can be done ahead at Dr. G. Viswanath CBCC Cancer Center, Trichy. And do not be afraid. I think. Doctor, thank you so much. Again, I would like to tell you that it was a very simple, a very a calm session. I was really worried about the topic cancer, but you in a very subtle manner helped us understand what these cancers are. Thank you so much, doctor. We'll be coming up with lives such as these in the future also. And to all our viewers, stay connected with
It's a
CBC.
pleasure
Thank
talking
you
to all
once
of you.
again.
Thank you. Thank you. It's a pleasure talking to all of you. Thank you.
Thank you so much.